Okay, guys, we're going to go through a quick video lecture here on ethics and some other stuff as well. And so here we go. Here is you on ethics. That's what you look like. Congratulations. Ethics define things that EMRs should not do. So basically, ethics are what you should be doing even when nobody's looking, okay? And the things that you shouldn't be doing are against those ethics based on morals. We have to live off of our morals when it comes to this. Honesty is important. We want to be as honest as we possibly can with the people we work with, including our patients. We need to be as honest as we possibly can, with exception in some cases. Kindness and compassion. We have to have kindness. We have to be kind individuals, and we have to show compassion. There's plenty of times you're going to realize, you know what, this is not the worst case scenario. I've seen worse than this. But reality is we've got to be kind to those patients because for them, at this moment, it is pretty bad. Advocacy. We fight for our patients. We fight for our patients' well-being. So we advocate for them. Case in point, had a patient that I transferred from the city of La Habra to PIH who had dislocated her hip. We'd put her on a backboard, and when we got to the hospital, we had to do what's called hold the wall. Basically, we're standing around waiting for a bed to open because they're busy. My patient now is beginning to have a lot of pain because she's sitting on a hard backboard with a dislocated hip. I can't take her off the board until I have somebody clear her of C-spine, making sure her spine is okay. And I know it's okay, but we need somebody to prove this. So my job is to advocate for her. So what I did was I found the first doctor I could who was willing to come over, take a look at her, clear her of C-spine so we could pull her off the board. Made sure that her neck was okay, her back was okay, so we could slide her off the board and back onto the padding on the gurney, which is better than the hard plastic of the backboard. So that's advocating, fighting for your patients. It's the simplest form of what advocation actually is. Advocating is. Okay, liability and negligence. There's somebody being sued, not a good thing. Okay, liability and negligence. Torts, we're going to talk about that. Don't worry about it. We'll discuss that a little further. But let's talk about assault and battery. Assault and battery is something that we could be accused of. Like I mentioned in our lecture the other day, I could be accused of assault and battery if I don't ask permission to begin treatment. Assault and battery is in the eye of the beholder. Okay, it's your perception. If I was to walk up to someone, put my hand on their shoulder, and they didn't want that, that in itself would be considered assault and battery. It's in that person's understanding of what's actually going on. So we have to be careful of this. It's very easy to be accused of assault and battery. Abandonment. This is me walking away from someone. I know that person needs care, needs help, and I didn't provide that proper care and help for them. I ended up walking away before I continued that care or, actually finish the process. And so abandonment could be a bad thing in a respect that could harm the patient, and more importantly, not more importantly, but that also affects you if you are accused of abandonment. Negligence. Negligence is where we had a job to do, we did it wrong. Or we had a job to do and we chose not to do it, knowing we should have. Okay. In other words, the leg needs to be splinted because it's broken, and I chose not to do it. Okay, just because I figured I don't feel like it today. And then the break becomes worse because I negligently forgot to or didn't do what I was supposed to, or I decided to splint it, but I put the splint on too tight, and now it begins to swell, and now they lost circulation, they lose their leg. I'm negligent. I caused that problem. So negligence is another thing we can easily be accused of. 4 components that are required of negligence: duty to act, a breach of that duty, harm was caused, and proximate causation. Okay, meaning I was the one that did it. I'm the one who was responsible for the problem. That's proximate causation. Harm was caused, meaning that harm happened because of my choices. I had a duty to act, I didn't act, and I breached that duty, or I didn't do what I was supposed to do. Here's a story happened in New York. In the city of New York, there was a couple of paramedics. They were at a restaurant having lunch. While they were sitting there having lunch, a female came in who was obviously pregnant, and she tapped them on the shoulder and said, "I need help. I'm in labor." These 2 paramedics turned, looked at her, looked at each other, and said, "You're going to have to call 911. We're not on duty right now." Okay, both of these guys were in full uniform. They were on shift. They were on duty. They were having their lunch in the middle of eating their lunch. The lady left and called 911. Now they're crew responded and provided care. I don't remember exactly what happened to the lady, but these two paramedics lost their job because whether something did or did not happen, they had a duty to act. And what people don't understand is when we work our shifts, 24-hour shifts, we are available 24 hours a day through everything. We don't get a lunch break. We don't get dinner break. We don't get breakfast time. We don't get a shift break. Now, after so many hours of time, you get 15-minute break. We don't get that. There's no such thing as that. We are responsible to provide care when and if it's time. No ifs, ands, or buts about it. Those two individuals were basically negligent in their job description. So you could prove they had a duty to act and they breached that duty. If harm had come to her, it probably could have been 10 times worse in that situation. So these are some basic things we need to understand talking about legal and law and basically ethics. That's really what it comes down to. As I mentioned in the lecture the other day, how do we prevent ourselves from having a lawsuit? Basically, what we want to do is we want to make sure that we always err in caution of the patient. It's kind of an ethical thing, right? If someone needs help, we provide help. So another question that always pops up too is, if I'm off duty, am I responsible to provide care? Okay. Morally, well, let's back it up. Ethically, yes, I am expected to provide care. Morally, I'm not necessarily expected to provide care. It's on me. I need to make that decision. Am I going to feel okay not providing care? I'm off duty, I'm not in uniform, I'm not working today. I can technically walk past it. Okay. But ethics wise, I think it's a good idea we step forward and help out to the best of our ability. There's a lot of stuff to talk about here. It's a really big, broad subject, and it's impossible for us to cover everything. So hopefully we can do some more work trying to break this open a little bit and understand where we stand. But again, one last time, you want to avoid lawsuit, you always err in caution of the patient. That's the most important thing. So you guys should have taken notes while you were doing this. That's about it for today. At this point, when you're done with this, there will be some questions that will pop up based off of what we just talked about, and I'd like you to go through those as well. Okay? Thank you very much, guys. Take it easy. Bye.